Today I would like to inform you on the topic of multiple sclerosis and the rising number of cases in our area. How many of you know what MS is or how it affects the body? Or maybe that we live in a hot zone? There are a rise in the number of cases in our area of young people, our age, college-age students, being diagnosed with this debilitating disease. With this speech, I'd like to inform you on what the disease is, symptoms, treatments, and then possible connections between our area and the rising number of cases. This is near and dear to my heart because my sister was diagnosed with MS just a few weeks after her wedding. She went from a wedding gown to a hospital gown in a matter of days. She was 23 at the time. I've watched the disease wreak havoc on her body over the past 3 years, so I would like to get some awareness out on what the disease is and how it works. MS is an immune-mediated disease in which the immune system attacks the central nervous system, which is your brain, your optic nerve, and your spinal cord. It is diagnosed using an MRI as lesions and scarring forms on the nerve tissue, and the MRI with contrast will light them up, and then you are diagnosed with the disease. The central nervous system attacks the myelin on our body. Myelin is a fatty protective layer on our nerve endings. So this is a nerve, and then these are the myelin that protect it. Myelin is the primary attack when dealing with MS. That is where all of the side effects come from. Myelin does not ever heal fully. It'll scar over, and the scarring is called sclerosis, and that is how the disease gets its name. Once the myelin is gone, however, it's gone, and you'll find permanent symptoms from this. Some of the most common symptoms of MS are fatigue. 80% of people that are diagnosed with the disease will suffer fatigue, tiredness, just feeling worn down. Often the first symptom that leads to diagnosis is numbness and tingling in your arms, your legs, your extremities, along with some stiffness. Balance issues, loss of balance, walking trouble, falling over, blurred vision, dizziness, these are all other common symptoms that a person with MS might suffer. 55% of cases of MS feel chronic pain or clinically severe pain, so they're just always in pain from the attacks on the myelin. There are also mental side effects, things like depression, anxiety, and mood swings, and they again are coming from the myelin scarring that is happening in their brain. There are also less common symptoms to MS, things like slurred speech or stutters, tremors, body shaking uncontrollably, difficulty breathing or swallowing, things like feeling pins and needles in your skin or like your skin is burning, on fire, or tearing. And then in some very rare cases, even seizures. MS is broken down into 4 different stages of disease. The first, being the most mild, is clinically isolated syndrome, where you will experience neurological symptoms of possibly blurred vision or dizziness for at least 24 hours. And your immune system has caused some inflammation to your central nervous system. This may or may not lead to the future diagnosis of MS. You may never have another attack. The most common phase is relapsing remitting, where you'll have an active phase of disease, you'll have symptoms. Then you'll also have a phase of remission or healing, where the myelin can scar over and symptoms may get better. Symptoms may go away, or in worst cases, they may become permanent. The next phase is a little more aggressive. It's primary progressive. It's more active. You'll have less phases of remission. You'll see more neurological side effects and the higher possibility of disability. The most aggressive form is secondary progressive. It is the most active. You'll have even less periods of remission. This will cause more neurological side effects and will have the highest rate for disability. MS is an invisible disease. In public, you might not be able to look at somebody and say, okay, they have MS. There's also no cure for this disease. Now, we don't have a cure, but we have ways to slow the progression of the disease down. Things like drugs or experimental treatments that are helping to combat some of the symptoms. The most common route in treating the symptoms of MS is the drug route. The first and most mild type of drugs are injectables, things like Copaxone, where they are given by shots to arms and legs and stomach. And I couldn't even imagine having to give myself a shot for the rest of my life every day. The next phase is a little bit more aggressive. They're oral medications, pills like Aubagio, Tecfidera, and Gilenya. And finally, the strongest, the most potent batch of MS medicine comes from monthly infusions. You'll get them once every 28 days or so. and they are Lemtrada, Novatrone, and Tysabri. Not everyone can get infusions, though, because they do run the risk of the rare brain infection PML. PML has a 95% fatality rate. The 5% that do not die from it have severe disabilities. So blood tests are done, and if you carry the gene or the trait, or if your CD4 counts are low in your blood, you're not eligible for an infusion. Patients are also often on drugs like antidepressants, things for anxiety and fatigue to help cope with their life with the disease. Some of the experimental treatments that are kind of controversial is CCVI, and it was discovered by Dr. Paolo Zamboni in an Italy university that patients with MS have abnormal blood flow in their brain. And the blood that doesn't flow out all the way is causing more nerve damage. So what he's doing is he is inserting a catheter through the vein in your groin, and it travels up your spine and your neck, and then you open it up, and it helps the blood flow more freely. Some people have seen symptom improvements, and then some have not, so it's kind of controversial. The MS Society is funding it, and it is being treated like this in Canada. The next is a stem cell treatment, HSCT, where a patient goes into the hospital, gets chemotherapy to get rid of their immune system, blood is drawn, and scientists convert the blood into stem cells, and then re-inject it into the spinal cord fluid. It goes to the blood-brain barrier, and it reboots your immune system. People are seeing that that's causing less attacks. They often don't need their maintenance drugs anymore, and there are some people that are reporting dramatic changes, feeling 100% better, feeling the complete 180 turnaround from not being able to walk to having feeling back. Now, we've learned what MS does and how it works, so let's learn about the connections to Ohio. In Galion, Ohio, there's about 12,000 residents, and there was 17 cases discovered one year. And they believe that there is a connection to, they dug up a cemetery and put a high school there. And they gave away the dirt from the cemetery, and then people started contracting some of the illness symptoms of the illness. Ohio actually leads all states in MS. We have 20,000 cases right now. Okay, that is most of any state in the United States. Most cases are discovered between 20 and 40, more female than male. The males do get a more aggressive type. Another connection to Ohio is a Mid-Ohio Valley Water Company found that their water was contaminated with PFOA, and it's an acid. They did a work study, and they found that per 1,000 adults, 310 were diagnosed with MS that were in constant contact with this contaminated water supply, making people think, okay, so there's got to be a connection to our environment in Ohio that's making these cases so frequent. So, we have talked about today that MS is a silent killer. It's not something that you can look and see in a person, and there's unfortunately no cure, and it is plaguing young people in our area. Okay, I hope that one day we can find a cure, and I hope that this helped you understand the inner workings of the disease, the symptoms, the treatments, what the disease is, the possible connection to our environment. Finally, on a closing note, I also want to hit on that we live in a society where we base a lot of things on looks. So maybe the next time you see a 20-year-old parking in a handicapped parking stick, your handicap right by the door, okay, don't judge them. We don't know what they're going through. We don't know if they have a silent disease like MS. I feel like we can't judge somebody because we don't know what they're going through. I hope that I was able to inform you on the topic of MS and some of the connections to Ohio. Thank you.